Good morning. Buenos dias. A very warm welcome to everybody. I am Dr. Karen Begg. I'm the Deputy Dean of Undergraduate Education at the Faculty of Health Sciences, UCT, and I will be your program director this morning. A very warm welcome. This is an exciting day, and we look forward to this graduation ceremony. I'm going to just explain a few things about what's happening today. The procession will soon enter, and before it does, if you would like to stretch your legs, this will be the last time to stretch for a little bit. So I'll indicate when we need to be seated and then to stand again. For those of you who are following this event digitally, please do tweet us using the following Twitter handles: @HealthZA, hashtag Cuban Doctors Grad 2023, @HealthSci, hashtag UCT NMFC Grad 2023 for all graduation news and updates. The graduation is also being live streamed from uct.ac.za, and all of the graduation ceremonies will be available on our UCT YouTube channel. Colleagues, for what's going to happen during the day is that the procession will come in to the sounds of our beautiful marimba jam band, and they will enter onto the platform. During that time, I will ask you to stand, and you will remain standing until such time as we ask you to be seated. The VC, the presiding officer, will then constitute the assembly, which is necessary in order to issue the degrees. We then will sing the two national anthems, and after that, we will ask you to be seated. So we'll guide you through the rest of the ceremony. There will be a number of speaking events, of some celebratory pieces of music, and then we will get to the important oath-taking and graduation. So a very warm welcome to all of you, and just to let you know that if you'd like to stretch your legs now, now's the time. And then I'll come and let you know when you need to be quiet and to remain standing for the event. Okay, thank you. the congregation to stand. Hola, buenos dias, sanbonani, molo, hallo, tobela, dumela, lumela, abusheni, sanibona, avuani, saliboni, bonani, and hello. I now invite the Acting Vice-Chancellor of Cuba, Professor Heidi Gonzalez, as presiding officer to constitute the Assembly.
By virtue of the authority conferred upon me, I constitute this Assembly as Congregation of Cuban Universities.
Please remain standing through the singing of the two national anthems.
Al combate corre meses que la patria os contempla curiosa. Non temais una muerte gloriosa, que morir por la patria es vivir. En cadena es vivir, en afrenta y oprobio sumido. Del clarín escuchad el sonido, a las armas valientes correr. Così sigue l'eli Africa, ma lo pagani soponoloio, i suoi mitana soietu. Così sigue l'ela tina, lo sapoluaio, mure la
Welcome, esteemed Deputy Ministers of Health of South Africa and Cuba, members of the Diplomatic Corps, Health MECs, Acting Vice-Chancellor of the University of Havana, Interim Vice-Chancellor of UCT, heads of provincial departments of health, deans, distinguished guests, graduates, family members, and loved ones, to this historic occasion when we commemorate newly qualified graduates from the Doctor of Medicine in the Nelson Mandela Fidel Castro Medical Collaboration Programme. I'm happy to announce that over the course of 2 ceremonies, we are graduating 454 new doctors from the Nelson Mandela Fidel Castro Programme. This brings the total number to over 3,000 medical graduates from this program since its inception in 1997. The procession was led by Marimba Jam. They are an award-winning social enterprise that both performs and teaches in African marimbas in South Africa. The band has over 10 years' experience performing at a variety of events, from big corporate functions to small intimate gatherings. They have also had the honor of performing for the likes of President Cyril Ramaphosa, the Western Cape Government, the Springboks, the Desmond Tutu Peace Foundation, and numerous weddings. I'm now going to invite Chief Mackey, the head of the Khoisan House of Traditional Leaders, to undertake a short traditional thanksgiving for the graduates. Chief Mackey, as descendant of the First Nations of this region, represents the communities that we serve as health professionals, as well as reminding us of the legacy of First Nations and Indigenous knowledge systems at the foot of the Hurikwacho, which means the mountain in the sea. We know it as Table Mountain, and in the place of the stars, which is where our health sciences faculty is based, called Ixhamaroidi Gais. Thank you, Chief Mackey.
Hokachi, we praise thee. Theoloche, my God. Theoloche, my God. Theoloche, my God. Theoloche, my God. The great Spirit Creator. We thank thee. We give you honor. We give you praise. Veneration, adoration. You alone we worship. And in memory of our venerable ancestors, mothers and fathers, Ganganchi, Abotse, Thank you to the 2 countries, Cuba and the Democratic Republic of South Africa. Have a long history of being together. Thank you to UCT. Thank you in particular to the Faculty of Health Sciences under the leadership of Professor Lionel Green Thompson, who felt it important to invite us to say these few words. We must never ever forget we face a vortex of violence, an age of uncertainty, an age of arrogance, healing and restoration. Let us never ever forget the boundlessness of our spirit. Truly, truly, may we remind ourselves today, everybody, but in a special way, the graduates, that we truly are sacred, created, spirit, human beings, not just human. Therefore, your task, your never-ending, forever task is holy, because we are sacred beings. Our action, our interaction, our speaking, our utterings must be followed by holiness, so that we bring hope in a time of abandonment. Let us give hope, the most basic of all the spiritual virtues. Let us cling to that. Let you bring it, and let the people that you work with remind you that yes, I too, serving you, healing you, restoring you, am a sacred created human being like yourself. Kaya, kanganchi, abotse, sidaitse, ay, oh.
Thank you, Chief Mackey. We're very grateful. I now invite the Interim Vice-Chancellor of UCT, Emeritus Professor Diaredi, to welcome the congregation.
Dr. Sibongiseni Dlomu, Deputy Minister of Health of the Republic of South Africa, Professor Fidel Mariana Reyes Obediente, Acting Deputy Minister of the Republic of Cuba, Professor Heidi Soca Gonzalez, Acting Chancellor of the University of Havana, Republic of Cuba, distinguished guests, colleagues, graduates, ladies and gentlemen. On behalf of the University of Cape Town, it is my honor to welcome you all to this happy occasion when we commemorate and celebrate our newly qualified graduates in the Nelson Mandela Fidel Castro Medical Graduate Programme. I extend a warm welcome in particular to our colleagues and friends from the University of Havana, Cuba, and from Cuba more broadly. It is a privilege to have you here with us. En nombre de la Universidad de Ciudad del Cabo, tengo el honor de darles la bienvenida a todos ustedes a esta feliz ocasión, en la que conmemoramos y celebramos a nuestros recién graduados en el programa de graduados en medicina Nelson Mandela Fidel Castro. Doy una calurosa bienvenida en particular a nuestros colegas y amigas cubanas. Es un privilegio tenerlos aquí con nosotros. Developing this program in cooperation with Cuba provided a creative and collaborative way of growing the numbers of medical doctors in South Africa. It is a fine example of a wonderful partnership of solidarity, friendship, and support, for which we in South Africa are immensely grateful. Since the inception of the Nelson Mandela Fidel Castro Medical Graduate Programme in 1997, as we have heard, we have had more than 3,000 medical practitioners graduate, or in any case who went on to complete their studies at the various schools, medical schools in South Africa. So there is a context for this, ladies and gentlemen. According to 2019 statistics from the World Health Organization, South Africa has fewer than one medical doctor for every 1,000 people. And in addition, most of these practitioners are men. This year, again, as we have heard, we are graduating 454 new medical doctors, and roughly 40% of them are women. This is a significant achievement and a substantial contribution. I take this opportunity to acknowledge those academic and support staff, family members, loved ones, all those who've provided material and moral support, who have made it possible for you, for our graduates, to achieve this great milestone in your lives. Today, we also acknowledge the efforts and the contributions of our colleagues at Cuba's medical faculties, who have played an absolutely central role in educating and training all of you, our new medical doctors. And of course, we celebrate with each of you for what you have achieved and accomplished. So congratulations on the milestone that you have just reached, and my very best wishes for all the good that you will do after today and for the difference that you will make. Thank you very much. Muchas gracias.
Thank you very much, Emeritus Professor Diaredi. I now invite the Deputy Minister of Health, Dr. Simbungiseni Dlomo, to address the congregation.
Master of Ceremony, the interim Vice Chancellor of the University of Cape Town, who has just welcomed us here, Professor Reddy, the acting Chancellor of the University of Havana, of Republic of Cuba, Professor Socha Gonzalez, the acting Deputy Minister of Health in the Republic of Cuba, Dr. Fidel Mariana Obediente, and all the delegation that you lead, my colleague MECs who are here that I would like to, by a show of hand, to indicate, because my leaders here, ababaz labaphathi. So I'll start with the MEC for Health in this province, Western Cape. Show your hand, you are up here. MEC for Health in Mpumalanga Province, MEC Manzini. MEC for Health in the Northern Cape, MEC Lekwene. And I apologize on behalf of other MECs who are going to be joining us in the day and the afternoon. I also want to recognize, for the sake of the graduates, other leaders who are key to your profession, the president of the Health Professions Council, Professor Nematandane. If you struggle to see Professor Nematandane, go to that office in Pretoria, ask for the registrar, a brand new registrar, Dr. Masike. So I've solved all your problems while you are seated here. To all the members of the Academic Review Committee, our professors in various universities led by Professor Mtla, who are present here, our former health attaché in Cuba, General Hadebe, who's present here with us. I'm informed that the current health attaché will be landing this morning from China. He went from Cuba, he got lost, he went to China, but he's coming back from China to join us here. Dr. Mandela, probably in the afternoon, will be here. Members of the UCT Senate that are present here, all the academics present here, imndeni yonke khona, family members who are here, friends, our graduates, members of the media, ladies and gentlemen, good morning. Sanibonani. Program director ke uzisho zonke izilimi, washo absheni, so ungcono akungikushiya kuyena ngoba ukwazi konke, so ngisho kunye engabe ngisakusho, angimane ngiphele isingisinje nesizulu. On behalf of our Minister of Health, Dr. Joe Pasha, who's unfortunately not able to be here because of other commitments in Pretoria, I bring greetings from our government in this august gathering of the congregation of the University of Havana, as constituted today by the acting Chancellor, Professor Gonzalez, to witness the awarding of the medical degrees to our graduates. A week ago, I got this message from my WhatsApp. It reads thus, I quote, "I'm leaving South Africa as we speak. Thank you for your unconditional support to my country, our cause, and to me personally. I grew and learned under your strong and dedicated leadership. I'm proud for my 25 years of service in KwaZulu-Natal," close quote. This was a WhatsApp message that was coming in from Dr. Gustavo Lopez, who currently was working in what we used to call Stenga Hospital, now called General Gizenga Hospital. He is among the first group of Cubans who came 25 years to our country. These doctors made themselves available in the most rural hospitals in our country. These doctors have contributed to improve the maternal outcomes in our country, improve the under-5 mortality in our country. They have comprehensively contributed to maternal, newborn, child and adolescent health and well-being. They have been part of monitoring antenatal visits when our HIV-positive pregnant mothers received ARVs early in pregnancy and gave birth to HIV-negative babies. Cuban people, loving people. How did this come about? Contribution of the Cuban people during the period of our liberation struggle is well documented. They fought with us. They fought for us at Quitocona Valley in Angola. President Fidel Castro once said to President Nelson Mandela, "We came to Africa and did not take silver or gold back to Cuba, but dead bodies of our soldiers who have been part of the wars of Africa." At the dawn of our democracy, President Fidel Castro responded to President Nelson Mandela's request in rebuilding our health system that Cuba would send to South Africa Cuban doctors to work in our hospitals. President Fidel Castro also offered that they could train South African students to become doctors, and such program therefore started in 1997. With these graduates we have today, the number of medical students qualified in the Nelson Mandela Fidel Castro stands at 3,071 doctors. With just over 40 of them specializing in various disciplines. As we meet in such gatherings, we always reflect on these two stalwarts, President Fidel Castro and President Nelson Mandela's vision and their distinguished revolutionary task, who brought about the change in the lives of many families, including these graduates that we have today. Today, we confirm that this relationship and partnership between South Africa and Cuba has yielded huge human capacity for the medical fraternity, particularly medical doctors. This is a remarkable milestone that cannot be hidden or forgotten, given the impact it has in South Africa. This is the legacy and the living testimony of the impact of this relationship brought by our stalwarts. This collaboration signifies the impact of Cuba that it has internationally in the area of medical collaboration. This celebration also highlights the importance of this solidarity work, which has benefited 165 countries around the world, including South Africa, from this social solidarity, excellent internationalism, and medical cooperation with Cubans through medical doctors and specialists. We do have our health attaché, Dr. Sanele Mandela, who's also a product of this Nelson Mandela Fidel Castro program. Some of these doctors who have come back from Cuba are holding senior clinical management responsibilities in various health institutions in our country. We are grateful to you, graduates, that notwithstanding the challenges that you faced, being in a foreign land, you persevered and left the program still intact for those who will come after you, as you did also find the program intact for those who came before you, starting from 1997. A round of applause to yourself. Why this also happened? This happened at a time when our universities in the country's intake of medical students were quite restrictive. We are happy that now most of our universities in our country have expanded their intake for students. Therefore, this program might also be then taking that into consideration. But however, the Cuban medical training has exposed our country into a world-desired approach, that of primary health care, an approach that is embedded in community diagnosis, community-oriented primary health care, the approach that was introduced in our country by Dr. Sidney and Emily Clark in Polela in 1940, supported by the report of Dr. Klukman, that also supported the national health insurance as we see today. This was long before the 1978 Alma Ata Declaration that talked about health for all in the year 2000. Notwithstanding that year 2000 came and it went, and yet there was no health for all citizens in the world. Our desire as South Africa for us today is to have this universal health coverage that has been informed by these processes, but however, also embedded into the vision of the World Health Organization. When visiting Cuba, which also I do quite often, but probably now some other people might have to visit, and it must be these leaders who have been trained there. When you visit Cuba, you find a specialist physician, a specialist surgeon working in a polyclinic. And I'm amazed, and I ask them, why as a specialist surgeon you are working in a polyclinic? They say to me they are providing the cost-effective, preventative, and quality health care by working at the polyclinic. They say it significantly reduces the theater times, it significantly reduces the theater slates of diabetic foot amputations. We don't want patients who are diabetic and hypertensive to complicate. We are treating our patients, and we show them pictures of gangrene feet following diabetic complications. With this approach, they've been able to eliminate many diseases in that country, including malaria. Cuban people, therefore, are very conscious of being a health-seeking nation in this regard. I am saying this to South Africans because the non-communicable disease, which is cardiovascular diseases, chronic respiratory diseases, cancers, diabetes, and mental illnesses, will become a pandemic in the next decade in the world and in our country. Countries who follow this approach of community-oriented primary health care like Cuba will escape that pandemic. As South Africa, we are still enjoying the valuable partnership through this medical brigade, where most of the doctors from Cuba are also serving in our underserved communities and universities. We also appreciate the enormous assistance we received during the COVID-19 epidemic through a team of medical doctors, including community health and infectious disease specialists who assisted us. Today, as the program director has indicated, we are here to confer Cuban medical degrees to 454 medical doctors who will work tirelessly day and night. Now, when you don't see 450, it's because we have another session in the afternoon. We just have this today, this morning. And we are actually aware that those graduates, now they are waiting for their names to be called while their bodies are shaking with disbelief. These are the words of our late legend in music, Utsepo Tsulo, affectionately known as the village pope. Let me take this opportunity to express our gratitude as Department of Health nationally to all provincial governments who have been consistently participating in this program through sending students to Cuba to become doctors to contribute to our public health system as a country in preparing rollout of the national health insurance to ensure that all South Africans have equal access and affordable health care, irrespective of their financial muscle and geographic location. These numbers, however, are making a significant impact in our human resource for health, in particular medical doctors. The demand for doctors and other healthcare workers remain a huge challenge in our healthcare system, and this increase provides inroads in increasing that capacity. I wish all the doctors, the graduates here today, welcome as a cadre of healthcare professionals, dedicated men and women, dedicated force that has demonstrated resilience. Of course, those who lead us and those that we find in our systems, in our health systems, who have shown resilience, who are going to welcome you. During the height of COVID, they were there. Graduates, as you take your Hippocratic oath today, kindly note that this oath describes a promise made by yourselves to try not to harm anyone, and you make this promise before God. The oath obligates you to make all efforts to protect individual rights and public interests. In your daily practice, as you serve those that are dependent on you in our health systems, please balance competing interests and values and draw your actions on ethical principles as tools for weighing conflicting claims and for reaching appropriate decisions. Your role is to save lives, lives of our people, not about saving lives of animals. You are not doctors. There are other doctors who save lives of animals, but you are saving lives of people who are in the image of God. I wish to express our gratitude to the families. Siyabonga kakhulu bazali. Bonke siyabulela kakhulu and all the relatives. Ngokuthi nime emva kwabantwana benu nibakhulekele, nibathandazele, nibasupporte, bekude, behleli kude nani. Yonke leyo mzamo yenu siyayibona, siyayibonga, ninxusa uNkulunkulu anisize kubantwana benu. You have been providing that support, and your patience waiting for them, babuyele Cuba, it's actually amazing. Today we celebrate their achievements, your achievements as parents into the South African health fraternity, to apply their knowledge, to acquire and contribute in building a sustainable health system in our country. There are some of them, unfortunately, who actually were having challenges along the way, and I was listening to the report over the past 2 days for the Academic Review Committee, trying to really focus in supporting them. But we are glad that those who come back are coming with a very strong focus on primary health care, which is going to be a key building block for our national health insurance in our country. And they have a desire, I know, a lot of them, to work in the rural clinics and hospitals. We hope that your learning background will continue to contribute in strengthening our resolve as a country of the universal health coverage, and ensure that the people of our country enjoy the health dividends of our democracy. The government of South Africa wishes again to appreciate the partners in this program, particularly the Cuban government, their universities, and our academics in the country, and all our universities who have also been very part to this. All our various provinces in their departments and medical schools have actually been very key to this. We thank the University of Cape Town for hosting this academic joint meeting, where we started with this meeting that I've referred to the past 2 days. We are very, very thankful to Professor Green Thompson, your organizing team, and Faculty of Health Sciences. As we congratulate our students, we wish to encourage you that before you go out into the world with what you have learned from Cuba, start in your family, start at home. Demolish those mud houses at home and build the family izindlu zama-blocks nezesteel. Nibasize phela sekhaya nibafakele ne-solar system bandla, shame. We now know ukuthi the siblings after those graduates are not going to line up for NSFAS, because you too can support your family. You are on the other side now. Pull them through. We pray that you go home and break the chain of poverty in your own family. Start there. Assist your village. Assist our country with your skills. Reach out for your dreams in doing that. Make our country a better country through your leadership. Teach our communities health promotion, disease prevention. Do it for President Fidel Castro. Do it for President Nelson Mandela. I thank you.
Thank you very much to Dr. Sibungiseni Dlomo for your address. We're grateful for your words of wisdom to our two graduates today. I'd now like to invite, in fact, we're very delighted to invite Nkanyiseli, Dianti, and Sipe Kwani to perform for us today. And I will share a little bit about them after they have shared their musical item with us. Thank you.
Cosa, una giornata sole, l'aria serena dopo una tempesta, e l'aria fresca pare già una festa. Che bella cosa una giornata sole, manna tu sole, più bello in me, o sole mio, sta in fronte a te, o sole mio, sta in fronte a te, sta in fronte a te. Quando fa notte sole se ne scene, ma fene quasi una malinconia. Sotto fa notte toia resteria, quando fa notte se ne scene. Manna tu sole, più bello in me, o sole mio, sta in fronte a te, o sole mio, sta in fronte a te, sta in fronte a te.
Before you leave, our choristers, if we can just thank you. If you can come forward a little bit just so that we can say thank you. The vibrant South African College of Music is a jewel in the crown of the University of Cape Town and at the forefront of music making in South Africa and internationally. Nkanyiseli Dianti is a young tenor who recently graduated from UCT and is currently studying towards his postgraduate diploma. Nkanyiseli has performed on stages such as Starlight Classics. He has sung in the masterclass with the head of opera program at the Guildhall, Dominic Wheeler, and is set to make his opera debut at Opera UCT, singing the role of Nathaniel in September at the Baxter Theatre. Thank you very much, Nkanyiseli. Sipe Kwani is a 28-year-old baritone singer born and raised in Khayelitsha, Cape Town. He holds a postgraduate diploma in music performance at the University of Cape Town Opera School, was introduced to choral music in high school, and in 2015 won his first prize in the Western Cape Choral Music Association. Since then, he has performed various choral roles in collaboration with the Cape Town Opera and the South African Collage of Music, Opera Kaleidoscope. He's won multiple prizes, both audience as well as masterclass prizes, and we're very grateful to the work that he's done. Won bursary competitions, and I think importantly, particularly related to the Sarah Bartman Hall that we are in today, is that he in 2022 performed the role of Alexander Dunlop in the new opera Sarah Bartman, written by South African composer Hendrik Hofmeyer. Thank you very much, Sipe. And then to Dale van der Vent, we're very grateful to you, to the prelude music, as well as the national anthems accompaniment. Dale has completed his undergraduate studies in organ performance at the South African College of Music and is currently pursuing a postgraduate diploma in the same field. He serves as Director of Music in St. Mary's Cathedral, where he conducts the cathedral choir and regularly performs on the organ. He's a member also of the Cape Town Baroque Orchestra. Very grateful to you. Thank you very much.
ngubo zasike zangathi zimbethe bavumelene unoyongoni batholisa imiqhele ewe kaloku bagqibile bangxangile bangxamile seningabalibazi kaloku ngoba balifezula ugqatso ewe bethwasile ngoba bathwasisiwe bayekeni bawelile umlambo umbashe hambani maqhawe nani maqhawekazi ngoba kaloku kaqathelo lizwe lenu go heal our land ewe bathonwelezela ngabathi into ke vuka mva an early bird catches the fattest worm. Rise, you eagles, rise. Rise, you generation of wisdom, rise. Rise, you generation of knowledge, rise. Fly high, you eagles, fly. Congratulations to all people of great honor. Sibamba ngazo zozibini nakunini nabeni bancelisa. Kaloma bela bongileyo. Sithi masenethole. Nakuni baxhasi bemfundo yabo. Sithi huntshu. Nxathoke. Sulane zonyembezi zeqhala kaloku. Nilile zovuyo. Ngoba umsebenzi ubuqali ugqityiwe. Hleka isichazo lokuvelana lokugqibela ngoba kaloku lo mqubu kadudubela uvuthiwe amadenga betyala kaloku madoda esithelo kamakhabu ucingosha umuntu omlambo uthithi bumsithi umjobi esithi nyantsi nyantsi nyantsula nyantsula yehe
Enkosi kakhulu to our Mbongi. Our Mbongi is a composer and orator of poems of praise. Mbongi offer critical commentary and narrative on the state of society through the Izibongo. The poem of praise and Umbongo was offered in honor of the graduates, their families, and their teachers. Neliswa Sampi is a UCT graduate with a degree in music education and honors in curriculum studies. She is a vocal artist and musician with 4 albums. She has traveled internationally with her music, with her own band and the Barnyard Theatre. She writes and recites her own poems as an Mbongi. She praises in various ceremonies such as weddings, graduation, and graduations. A sincere thank you to Neliswe Sampi for her poem of praise for the graduates. Enkosi. I'm now going to ask Associate Professor Tracy Naledi to lead the graduates in pledging their declaration of oath.
I will request all our graduates to stand, please. I will request all the health professionals in the house to stand, please. I would like the graduates to take a moment. Take a moment to look around you. Take a moment to look at your family. Take a moment to look at your friends. Take a moment to look at your community. We will ask Chief Maki to please stand to receive the promise and the oath. I would like you to look at Chief Maki. I would like you to remember that the promise that you are making to your family, to your friends, to your community. This is a promise that we make in front of a community leader for them to receive it, but for us to also remember the great injustices that have happened in the hands of many just like us. To remember the great injustices that have happened with others like us just watching. We are standing here to make this promise in front of our family, our friends, and our community to say to them, hold me accountable. I would like you to turn to page 3 to make the oath. I would like you to follow me. I will make a statement. You repeat after me. I will use my own name, but Nani, use your own names. Don't use mine. You are promising. Don't promise on my behalf. Promise on your own behalf. Are you ready? Okay. I, Tracy Nalemdi, solemnly swear to serve humanity.
I, Karen Big, solemnly pledge to serve humanity.
My most important considerations will be the health of patients, the health of their communities, and the health of the environment.
My most important considerations will be the health of patients, the health of their communities, and the health of the environment.
I will not permit considerations of age, gender, race, religion, ethnic origin, sexual orientation, disease, disability, or any other factor to adversely affect the care I give to patients.
I will not permit considerations of age, gender, race, religion, ethnic origin, sexual orientation, disease, disability, or any other factor to adversely affect the care I give to patients.
I will uphold human rights and civil liberties to advance health, even under threat.
I will uphold human rights and civil liberties to advance health, even under threat.
I will engage patients and colleagues as partners in healthcare.
I will engage patients and colleagues as partners in healthcare.
I will practice my profession with conscience and dignity.
I will practice my profession with conscience and dignity.
I will respect the confidentiality of patients, present, past, living, or deceased.
I will respect the confidentiality of patients present or past, living or deceased.
I will value research and will be guided in its conduct by the highest ethical standards.
I will value research and will be guided in its conduct by the highest ethical standards.
I commit myself to lifelong learning.
I commit myself to lifelong learning.
I make these promises solemnly, freely, and upon my honor. Welcome to the profession. Kaikas Gangans, Chief Maki, please be seated.
I now invite the Acting Vice-Chancellor of Cuba, Professor Heidi Gonzalez, to confer the degrees.
I admit to the degrees the Doctor of Medicine to the candidates recorded as in absentia. I shall admit to the degrees Doctor of Medicine to candidates presented to me.
Of the Acting Vice-Chancellor of the University of Havana for Cuba, representing the community of Cuba. Thank you. Namhlanje sihlangana namhlanje ukujabula sithi inkosi kakhulu kodwa masimela kancane sikhumbulo labo balahlekelwe endleleni. I ask us just as a community to stop a while to think about those students who took this journey many years ago and have not been able to complete because they have died along the way. From Gauteng Province, Phomolo, Maiti, Mahika, From Mpumalanga, Mtunzi, Wiseman, Zwane. And from the Northwest, Kiabetswe, Rakoma. I ask us just to hold a moment of silence as we remember them and their families for whom this celebration would have meant so much. Thank you, colleagues. Facing the community, looking out there. Bongani Mkabela. Go through. Face the community. Kola Mdingi. Ntando Memory Makubela. Masontaha Anita Mbipi. Farai Mawita. Andiles Kosana. Matobela Shelin Kekana. Come and stand here facing the community. Obakeng Bohatso. Come and stand here and face that way. Retabile Lechodi. Sipo Ricius Mkondo. Riabetswe Hongkang. Kagiso Beauty Khoza. Mabato Prudence Mabulwane. Linda Judas Mashabane. Machuchu Abednego Raselabe. Atule Komi. Zakele Goodman Mashobo. Zetu Helen Mshongo. Ntando Makubela. Just tell them we can move in. Begitemba Gamini. Can I just say to the graduates, when you get here, stand next to me and look out. Lebogang Pesilia Marke. I'm not going to comment on best dress today. Pelogazi Kawe. Randall Boer.
Keep their tags so that they're not just worried about their...
Some of them want to keep them. Josejo Jonas. Potso Austin Lebogang. Lungisani Bongumenzi Mbonambi. Sifiso Mvelo Biela. Matodzi Confidence Mapari. Sfiso Treasure Gama. Nogukanya Tembega Mazibugo. You want it? Khosi Itsile Letwaba. Paul Ngombane Hatebe. Marius Samuel Mashaba. Karen Khomotso Ntimane. Precious Ntombenhle Manyati. Karabo Wendy Bopape. Buyani Fakute. Adam Welcome Godi. Sonwabo Malingwa. Mabuto Malote. Kucho David Mafifi. Oscar Pilas Mabusa. Hopolang Homaracha Maholela. Benedicius Maboshakwana Masipa. Lennox Thungwani. Valrosha Graham. Lungile Chapola. Tulani Jubela. Mawande Nyambali. Onele Mondi Mnetwa. Ntlantla Octavia Mashangu. Spiwe Prince Kubega. Maxon Lebochang Daku. Makausu Mshorisang Monyela. Look at the camera and smile. Trene Betty Mabokela. Mahlodi Bridget Maburu. Naledi Sherlene Mawelewele. Tato Situnsa. Akumile Kolosa. Vuchila Baloi. Kutso Sarafina Lechaba. Goodness Khanyaho. Moseki Richard Nkhe. Go. Bongile Feni. Amogelang Majatladi. Tumisang Begonia Kole. Tokelo Masaka, Itumeleng Lebesa. Surprise Ubisi. Lindo Kuhle Dlamini. Nonofo John Baikai. Mpendulo Kosi Jele. Memory Mangane. Tabiso Romario Manuele. Tapelo Links. Goizione Gerson Kefalotse. Poelo Frederick Mashicho. Sepiso Steve Mawasha. Tembankosi Mangane. Patrick Makaise. Kagiso Anthony Mabale. Gwyneth Mamsi Maketa. Tokoloho Abednego Maketa. Mocha Etsi Zira Mautla. Just stand one step forward. Matolo Anna Mamosadi. Bongani Tsanibe. Desiree Guguletu Nkunu. Zinhle Evidence Madi. Tuli Inosipo Makatini. Is it Bexy Obakeng Khobe. Supetso Balepile. Odireleng Letlhatle. Solonang Mahoke. Bocello Charlotte Mereyotle. Mpo Walter Khawahwe. Gladys Kelobogile Lebalo. Marcela Tole Rochelle Mampuru. Clementine Lindy Fumu. Dineo Jennifer Mfati. Zandile Ntombifuthi Madondo. Edwin Masejo Kodisang. Eugene Tiseko. Orlando, as in Spanish. Orlando Shangwane. Go. Letlogonolo Cedric Kolojani. Go. Kagiso Sean Mampani. Siboniso Goodenough Mkize. Tamsanga Samukelo Righteous Mbata. Go. Kensani Vanessa Tangwani. Sipogazi Gkhana. Nogubonga Valencia Mlochwa. Mahlatsi Maria Mokwena. Okay. Lele tu Makhohliso. Manoko Michael Kabe. Vicky Dixon Mapanga. Nhlamulo Elijah Maluleke. Nelisiwe Mshenyama. Sitembile Pinky Kumalo. Ebeneza Pilangwe Gezwi Mapanga. Muzi wake Gabriel Tamsanga Kumalo. Wait. Reuven Chetty. Sipe Sande Letese. Dineo Constance Ramatejane. Mercy Mashabela. Tebogo Petrus Hukutli. Andy Swe Buso. Ndivile Lamani. Musa Gini. Marvin Mtutuzi Mapange. Begumusa Nhlakanipho Maseko. Mbuso Maki. Go. Tsunani Hope Mashava. Mabota Agri Lepondo. Hey, Joe, stethoscope. Matele Petunia Mameche. Go. Mamoloko Emission Manake. Sello Jeffrey Mfene.
They forgot one name here. Can you say it? Emmanuel.
Right, in between.
Emmanuel Kenene.
Mzwandile Emmanuel Gininda. Stand here and look at the camera. Nkosi Khona Ernest Nkosi. Enkosi kakhulu.
Another large round of applause for the graduates. We have a few last items before we once again congratulate our new graduates. A hearty congratulations. I'd like to ask Dr. Adam Godi to come and address the congregation on behalf of the graduates. This is the class representative, and he has a few words to say on behalf of the class.
Lani, wenukhalelani thulamtana wenukale sizojika izinto wenukhalelani thulamtana wenukhalela oh thulamtana wenukhalelani Hey, hi, 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 hi. Wenukhalelani, thulamtana, wenukhalelani. Sizojika izinto, thulamtana, wenukhalelani, thulamtana, wenukhalelani, thulamtana. Wenukhalela jika izinto thulamtana thulamtana wenukhalelani thulamtana wenukhalela Thank you, Program Director. I'll be very short. Kind greetings to the representatives from the Republic of Cuba, Prof. Haidt Soka Gonzalez and Dr. Messi. Greetings to the Republic of South Africa, all heads from all the departments, in particular, the Department of Health. Greetings to our provincial coordinators. Greetings to the representatives from our local South African medical schools. Kind greetings to our parents, and we thank you so much for all the support and your prayers. And kind greetings to my fellow colleagues, the 2023 NMFC graduates. We thank you so much, guys, and congratulations. On behalf of the 2023 NMFC graduates, firstly, we would like to thank the UCT for hosting us. And I would also like to say a word of thanks to the Republic of Cuba and the Republic of South Africa, in particularly the Department of Health from both sides, for giving us this great opportunity to study medicine and become doctors. Most of us wouldn't be doctors today, because we come from very disadvantaged families, such that they wouldn't afford to pay for our fees. So we appreciate this opportunity. So we want to promise all of you that we will work very hard. We will work very, very hard to serve our communities and to serve our beautiful country. And I would also like to encourage my colleagues that the journey was not easy. It was a lot from us and from our parents, from everyone who loved us. It was very difficult, but guys, congratulations one more time. So I don't have much to say, but I would like to thank the South Africa, the Republic of South Africa and the Republic of Cuba for giving us this great opportunity. And thank you so much. Muchas gracias.
We thank our newly qualified Dr. Adam Gordhi as class representative representing the class of 2023 for his address to on behalf of the graduates. I now invite Acting Deputy Minister of Cuba, Professor Fidel Mariana Reyes Obiente, to address the congregation with a concluding message.
Esteemed Deputy Minister, distinguished guests, graduates, and family members, today is a remarkable day. It marks the culmination of a significant chapter in your life, where your aspirations have become a reality. Your dedication and hard work will be rewarded with the long-awaited medical degree. The University of Cape Town welcomes us today together and commemoration this remarkable accomplishment together. The arduous time and the separation from your families and homeland are now behind you. Today is the beginning of the new phase for the 454 graduates. You have encountered numerous challenges along the way, and you have overcome them by exemplifying your core values. We anticipate that you will not only remain devoted to your country, but also cherish the memory of your time spent in Cuba. Congratulations to each and every one of you, and may you find among success in your future endeavors. Thank you very much.
Fidel Mariana Reyes Obiente. I now invite the Western Cape MEC for Health, Dr. Noma French Mbombo, to give a word of thanks.
If we had time, were to sing, Ninje, nje, nje, ngumama, ninje, nje, nje, ngumama, dili yoko yoko, ninje, nje, nje, ngumama, ninje, nje, nje, ngumama. Thank you very much. Thank you very much. On behalf of the provincial health systems, because I'm not only thinking on the behalf of the Western Cape, but on behalf of the provincial health, because we do know that the hospitals, the patients, the health facilities, and also the human resources on service delivery, the mandate are owned by the provinces. So on behalf of the provincial health, I want to thank firstly the National Health Department, to you, Deputy Minister, and also to the National Health Minister in absentia, and also your team at large. I want to thank you for doing it for the provinces, because you are doing it for the provinces. And then secondly, I want to thank it on behalf of the education system, because it's the universities, although higher education is not here, but it's the universities, because it's not only the UCT, although the UCT is hosting now, but all other medical schools that have also been participating in this process. So thank you very much. And then for the UCT, thank you for hosting, starting from the interim Vice Chancellor, the deans, and everyone who's here, including our MC. Thank you very much for hosting, and also including the staff that are here for hosting these processes. And then also we want to thank everyone who's here, but specifically I did put it there so that I know they normally accuse me of cultural appropriation. I don't have an issue with that, but I wanted to do it in style, Chief. Let me just check, where did I put it? Because I want to thank you in a correct way in regard to the language. But I think what is crucial, your presence here, to have the chiefs and from the culture, you are representing the patients that you are to service. And I'm glad when the Deputy Dean reminded us that we have got social accountability to our communities. So if probably I'm okay, if I say good morning, am I correct when I say that? I say, "Xa ayiqiwas." Got it. Thank you. Thank you. Gan. Okay. Thank you very much for that. So it's a reminder that we are here for our communities, leaving no one behind. As I always say that, we cannot leave anyone behind. So thank you very much for that. To the parents, it has been headaches. I know even when your child or your family member is maybe in the Eastern Cape, you are in the Western Cape, you are in Limpopo, they're in Mpumalanga, you always get worried. I wonder, umntanam ulele etyentoni. I hear these stories about what is happening there. I wonder, akagezi na bethunana uzwelakhe kula Cuba bethunana. So you cried buckets of tears. We know where you wanted for their success. And I just hope, and as you can see now, that at least your prayers have been answered. And then probably still gonna be praying more. Some of them, they might be done, or they're still gonna do their internship, and then they'll be ComServe. Will there be an appointment to be them to do ComServe? Once they are done with the ComServe, to be medical officers. So you still have to pray further, because it's still gonna be a challenge, but at least your prayers have been answered. I think you need to clap hands for yourself for doing that. Nisebenzile, ayontwana ukukhulisa abantwana. Nisebenzile. And now, lastly, to our team, because you are part of a team now, it is said, welcome to the profession. So you are part of us, as part of the health system. So for you, it has been sleepless nights. It's not easy, actually, to undergo any kind of education, whether it is a matric, whether it is a basic. But that we have not only have to undergo it elsewhere in Cuba, plus also 2 universities. It is a challenge and different context when you started in Cuba. So for doing that, and you are all here, your prayers have been answered. So what I want you to do is about you stand up and clap hands for yourselves. And as I always say that, whom shall I send? Who is going to go for us and take care of the anti-SARS? Noting that the system is no longer the same, where it was hospice-centric, as Dr. Dlomo indicated, talk about the community-oriented primary care. People will put, pointing fingers at you, saying that you are you are different from the others. Remember, you are doctors. You are part of this health system. And you have got further kind of the skills and speciality that some of those who trained here might not have it. Use it. So whom shall I send? We are sending you to those people where we know that almost 60% of the health problems are not necessarily because of misbehavior or because of the biological or because it's about our fault as patients. But 60% is a result of the social, the economic, the cultural, the political, and also our health system. So we rely on you to always remind us that when it comes specifically to primary health care, you leave no one behind. The issue of the access and also social determinants of health is supposed to help the South African health system that has always been hospice-centric. So we're sending you in the environment where actually you'll be bringing your cell phones because there won't be any lights, load shedding, those lights. But because we have been given all the triple H, the H, first one is about the matters of the head, your cognitive from your teachers, matters of the hands, your gross motor skills, where you are already trained. But one thing, last thing, which is for me, is very important, the matters of the heart. No one can teach you how to smile. Might have all your degrees and everything, but you have to make Auntie Sarah feel that is part of it. Because you are going to an environment, a health system now that where patients are the core carers. Never leave them behind. Last but not least, to Cuba, yes. Okay, I need to check again to appropriate cultures. So you were saying, is it Cuba? Cuba, okay. I'm getting there, So I must say it also in Spanish. I'm only learning French, but Spanish I'll be there. Is it buen dia? Good morning, what is it? Yes, I'm trying to do that. I don't know how it is, but I wanted to do in the language. We thank you for coming here. It's winter. Probably you're supposed to be sitting there, maybe by the beach and doing what you're supposed to, but you came here, not only in South Africa, but also in Cape Town. But also that you even undertaking to continue with the program. In as much of that some of us might not be participating, but Oksalayo, we are all South Africans. You are trying to help our system. I want to thank you from the Acting Vice Chancellor, from the Ministry, and everyone of your team for helping our children, our families, and everyone. Thank you very much. Thank you.
Nkosi Kakulu in terms of, for our Western Cape MEC, Dr. Noma French and Bombo. We're very grateful for you being here today. We now come to the end of our ceremony, and this is a very exciting, it's been a very exciting time. It's been a long time, but it's been very exciting. Graduation is the highlight of your career, your academic career. It's the time when everyone involved in your academic endeavors comes together. Your teachers, professional staff, parents, sponsors, loved ones, and of course together as friends. Members of management and leadership of the universities are all here, governments who sponsored you, and so we're all here to honor the hard work that you've put in over the 3 or more years to be able to sit here today. What we would like you to do is to stand and to point at those with your certificates, those of you who have them, to point at your family members, just to honor them for the commitment and sacrifice that they have placed on behalf of you. So if you'd all like to stand, point at your family members to say thank you. Woo! Thank you so much. You may be seated. And so today is a celebration, not just of what you have accomplished, but also what we believe you will do after you walk out of this hall and as you live your lives following graduation in service. We want to take this opportunity to charge each of you to take part in unleashing your abilities and the abilities of those around you. We're sending you out into a world that desperately needs your kind of leadership. We are entrusting our future to you, and we are proud to do so. Congratulations on this milestone you have just reached, and best wishes for all the good you will do from today onwards. In terms of the closing, we're going to ask each of you to stand in a moment and to remain standing while the procession leaves the hall. It is raining outside, a blessing, as Cape Town showers you with its blessings on graduation. So the colleagues will leave the procession and walk out under cover. We ask each of the graduates, the ushers will guide you to join us as colleagues in joining the procession. We ask the family members and guests seated here to remain standing until both the procession and the graduates who join the procession have left the hall. The recessional march will be accompanied by the music from Marimba Jam at the back. We just want a couple of items is, please, those of you who are collecting lunches, down the stairs and to your right, the Robert Leslie building. Those of you who were unable to collect your graduation certificate in the round, they will have those certificates available for you in the maths building where you collected your tickets and your gowns. So when you return your gowns, they'll have your certificate ready for you there. All right. So colleagues, I'm going to now call upon the presiding officer to dissolve the congregation. The acting VC, Professor Gonzalez, if you can close the congregation.
By virtue of the authority conferred on me, I hereby dissolve this congregation of the Cuban University.
Please stand.